Ever since I was a kid in grade school, I knew I'd become a doctor. When I was young, I had an injury, and I spent 40 days in the hospital, 40 nights in the hospital, and I had injured my spinal cord. So the hospital that took care of me was the Mass General Hospital. So it was the doctors who believed in me. Many thought I wouldn't walk again, wouldn't regain my mobility, but it was the doctors, the nurses, the physical therapists who helped me, and it took 2 years to fully recover. It was my parents, my sisters who stood by me. And that's the message I have to my patients. And part of my philosophy is we are all in this together. In pediatric orthopedics, you're taking care of kids of all different age groups, you know? And so you see a lot of different things. So you have to be prepared for the kids who are crying, you know, when the cast comes off, it's the noise from the cast saw. And they're kids who just make us laugh. That's one thing about pediatric, is you'll have patients and, you know, there's a lot of laughter in our exam room, in our hallway. It's just a fun place to be. And when I'm in the exam room, I speak directly to the patient, you know, and I spend time answering their questions. We know a lot of things in medicine, but there are things that we don't know. And if I don't know, I'll tell them that. But they can expect to get the best care that they could get anywhere. We have a fabulous team. Any case that I take to the operating room is presented in conference. And so I get the opinion of all my colleagues too. So they have the benefit of knowing that they actually get multiple opinions. And so I try to help the patient choose the best option for them. There's one patient who had an amputation, a traumatic amputation of his arm, you know, a young boy. And he works on the farm, so he needs his arm, you know. And I met him in the operating room, a brave kid. I'll never forget that, him and his father, you know. And his arm was just hanging on a piece of skin. But with the plastic surgery and me leading the orthopedic team, his arm is back on. His arm was replanted. And I just saw him recently. He shook my hand, and which is amazing. I'm living the dream, you know, to be able to do what I do every day, thanks to this great hospital.